Thank you so much and good evening to all. This is the study which was presented in the last ASCO 2020 virtual meeting. This is actually the final survival results from SPARTAN study. SPARTAN study is a phase 3 study of apalutamide versus placebo in patients with a non-metastatic castration-resistant prostate cancer. Apalutamide is nothing but androgen signaling inhibitor, and this was compared to placebo in the subgroup of patients who are having who is at high risk for developing metastasis. So this is the study design. Non-metastatic castration-resistant prostate cancer patients, pelvic nodes less than 2 cm below iliac bifurcation. The PSA doubling time less than 10 months were included, and those who are already on continuous, these patients are already on continuous androgen deprivation therapy. In addition, they have stratified according to the prostate PSA specific doubling time, and more than 6 months versus less than 6 months. And also bone sparing agents used or not, and also lymph node negative as well as N1 lymph nodes were included. And they have stratified into 2:1 stratification and the randomization, and then one arm is apalutamide 240 milligram added to androgen deprivation therapy, and second arm is with the placebo added to androgen deprivation. So the first endpoint was median metastasis-free survival, and then subsequently when patient progresses, the physicians directed therapy of subsequent, and also the sponsor provided abiraterone plus prednisolone. And the final event was analyzed in terms of overall survival events. Here the method and the statistics used were basically overall survival in the first interim analysis was found to be significantly better, and this was, and subsequent events were analyzed according to O'Brien-Fleming type alpha spending function. And this is the final disposition and final analysis. This is how they were planned. And this is the median overall survival, which was significantly higher with apalutamide. About at the median overall survival was 73.9 months with the follow-up of 52 months, and the median treatment duration in the apalutamide was 32.9 months, and whereas the placebo it was 11.5 months, and median overall survival was significantly longer with the ABA arm, as you can see. And also with the unblind, with the primary endpoint in the initial analysis was met, so this was got approved, and then about 19% of the patients from the placebo group was unblinded, and if found to be non-metastatic were allowed to cross over to the study arm. And also you can see there is the final analysis of the overall survival benefit was maintained in across all the subgroup, where you can, this is the forest plot curve, where you can see all the subgroups were benefited with the apalutamide compared to the placebo. And this is the subsequent analysis also showed the patients who are on apalutamide had a significantly higher time to start initiation of chemotherapy compared to placebo, as well as there is a significant lengthening of symptomatic progression. So the apalutamide has met almost all the initial endpoints, like the time to initiation of chemotherapy, and there is a significant prolongation of symptomatic metastasis, as well as also there is a asymptomatic, only marker alone relapses are also prolonged with the apalutamide. You can see about 40.5 months compared to the placebo, where it is just 3.7 months. And one more additional parameter they have studied is the second progression-free survival, which is it's about second progression-free survival is about 55.6 months compared to placebo. It is about 41.2 months. These are some of the adverse events. You can see that grade 3 or 4 events, adverse events are comparatively less, and only one death that due to the myocardial infarction and is thought to be due to apalutamide related. If you look at the various adverse events, you can see the rashes are the majority, and also there are fatigue and hypertension and fall about it's also about 3%, and there is it's all grade 1 or grade 2 insignificant adverse events in the apalutamide, and the discontinuation rates due to the side effects were very few and less than 15% of the patients. So the conclusion, the addition of apalutamide to androgen deprivation therapy significantly improves the overall survival and compared to placebo, and with a median overall survival of more than 6 years in the apalutamide arm, and about 14 months improvement over placebo. And it also lengthens time before initiation of cytotoxic chemotherapy in patients with non-metastatic castration-resistant prostate cancer. And also all primary and secondary endpoints were improved with apalutamide. The benefit from apalutamide was observed despite 19% crossover from placebo. Also, the safety profile of apalutamide was consistent with the prior interim analysis, which were again confirmed in the final analysis. So the take-home message is, in the non-metastatic castration-resistant prostate cancer, apalutamide significantly improves overall survival, and this is a practice-changing study. And I hope that in view of the very good favorable safety profile, apalutamide will be a treatment of choice in such patients. Thank you all.